Hello, and welcome to Norton Women's and Children's Hospital, a center of excellence in minimally invasive gynecology. I'm Julia Mashburn, a nurse here on 2 East, our women's surgery unit. Myself, or one of our other dedicated women's surgery nurses, will be caring for you or your loved one after surgery. Today, I'm here to discuss some best care practices and tips that will be helpful for a speedy recovery. Both while in the hospital and at home, wash your hands before and after touching any incision sites. Only touch your incision to clean it with antibacterial soap and water, but do not scrub or rub hard on the incision. After cleaning, make sure to thoroughly dry the area. Do not let anyone else touch your incision sites without washing their hands before and after. Keep incision sites clean and dry. Take any and all prescribed antibiotics the doctor gives you. However, not all patients will require antibiotics. Watch for signs of infection, which include a fever greater than 100.5, smelly pus-like drainage from any incision sites, or large area of redness or warmth around your incisions. Report any of these to your doctor immediately. While at home, make sure bed linens are clean. Also, while at home, keep pets away from your incision. Basic post-surgical care for at home. Take it easy. No lifting more than 10 pounds, which is about the weight of a gallon of milk. This also includes pushing or pulling heavy objects such as vacuuming, lifting heavy groceries, picking up small children, or picking up pets. Nothing in the vagina until cleared by your doctor. This includes not using tampons or douches, not having sex, and not placing any objects in the vagina. You may experience mild vaginal bleeding or spotting, which is normal after surgery and should only require the use of a light pad. This will typically last a few days. However, if bleeding becomes heavy, like a period, please notify your doctor. You will be able to shower, however, no swimming, hot tubs, or tub baths until cleared by your doctor. You can ride as a passenger, however, no driving until you are no longer taking narcotic pain medication. You can walk as much as you tolerate. Walking is excellent for both healing and preventing blood clots after surgery. You can also walk up and down stairs as much as you tolerate. Please call your doctor if you develop a fever, have excessive vaginal bleeding, or develop redness, swelling, or pus-like drainage from any of your incision sites. Always remember, if you have any additional questions or concerns, please call your doctor. Pain medication, both at home and at the hospital. While at the hospital, you will be prescribed pain medication. This medication will be available on an as-needed basis and can typically be given as frequently as every 4 hours. Pain medication will not automatically be given, as everyone's pain is different. Therefore, it will be necessary for you to ask your nurse for pain medication when needed. It is also important to not let your pain level get extremely high before taking pain medication, as it will be more difficult to get the pain under control once extremely high. Your doctor will be the person who determines the best type of pain medication for you based on the surgery you have had. If additional or different pain medication is needed, it will be necessary for your nurse to contact your doctor for any changes. You will be prescribed narcotic pain medication both while in the hospital and while at home. This medication can typically be taken every 4 to 6 hours as needed for pain. DVT Prevention. A DVT, or deep vein thrombus, is a blood clot that forms in a deep vein of the body. After surgery, a patient can be at an increased risk for blood clots due to a lack of mobility. To prevent blood clots, immediately following surgery, you will have sleeves on your legs that help promote blood circulation. You will be wearing these until you are comfortable getting up and down out of bed on your own. Also, to prevent blood clots, your doctor may prescribe a one-time dose of blood thinner, typically called Lovenox, to be given the morning following surgery. This medication will be administered by your nurse and will be in the form of a small shot given in the belly, not near any incision sites, that should be relatively painless. Ultimately, the best way to prevent blood clots is movement, which is why the nurse or nursing aid staff will assist you in walking the same evening you get out of surgery. Once at home, to prevent blood clots, elevate your legs by propping them up on a pillow while resting. Walk regularly to increase your blood flow. Change body positions often by moving and stretching, and do not smoke, as chemicals in cigarettes can damage blood vessels. Foley catheter care. Depending on the type of surgery you have, it may be necessary for you to go home with a catheter. Catheters will empty your bladder of urine and will help prevent kidney infections. If you do go home with a catheter, this will typically be just for a few days and will then be removed by your physician at an additional follow-up visit. Once in place, the catheter has a small balloon at the end that is filled with solution to hold the catheter inside your bladder. Therefore, your catheter will be secured internally and will not easily come out. The catheter will be low maintenance. All you will have to do with the catheter will be empty it as it starts getting full. Please know you will still be able to walk, sleep, shower, and function as normal with the catheter. Additionally, prior to your discharge home, your nurse will provide you with a handout and personal instruction and demonstration on how to empty the catheter. As for caring for your catheter, clean your genital area every day using soap and water. You can clean both your catheter tubing and around the area where the tube is inserted. Secure the catheter tubing to your leg using securing devices provided to you by your nurse. This will prevent the catheter from pulling and help prevent pain. To care for your drainage bag, which is the bag that collects the urine, keep it below the level of your waist and do not loop or kink the tubing. Also empty the drainage bag when needed, every 3 to 6 hours or when the bag is 2/3 full. Also remember to drink plenty of fluids and wash your hands before and after emptying your drainage bag. Preventing constipation after surgery. Drink plenty of fluids, eat your vegetables, and take frequent short walks. If taking pain medicine, take a stool softener such as Colace up to 3 times a day. If you have not had a bowel movement by 3 days after surgery, in addition to the stool softener, begin taking a gentle laxative such as Miralax or milk of magnesia. For persistent nausea or vomiting, call your doctor. If you have not had a bowel movement for 5 to 6 days, call your doctor. On behalf of all of us here at Norton Women's and Children's Hospital, we thank you for choosing us, and we wish you a healthy and speedy recovery.